So the obvious answer is if patients are able to associate in their own minds with or getting anxious or stressed with the development of their GI symptoms, that's simple, right? But you're right, a lot of times patients aren't able to connect the dots. And so what the physician has to do as the detective is to try to make associations between symptoms and specific situations. Okay, now we've talked about diet, and that can either be an association with the foods that the person's eating or with the anticipation of having problems that can go along with eating. So again, a conditioned response. But there are also circumstances where you'll talk to patients and you'll say, where are you most likely to get your symptoms? And they'll say, or I'll actually ask them, are you more likely to get your symptoms during the day or at night? During the day. And then I'll say, are you more likely to get your symptoms during the week or on the weekend? And they'll say, during the week. And I'll say, are you more likely to get your symptoms when you're at work or at home? At work. Are the problems associated with a particular activity or with a particular person or persons? And you can see how then all of a sudden, by the way, it's not only helping you, it's helping the patient to connect the dots themselves, because a lot of times they'll have an aha moment where they'll say, oh, gosh, I never made that association. And in that circumstance, again, taking a more holistic approach as opposed to jumping right to medications can really be the difference between offering the patient maximum benefit versus maybe just nibbling around the edges in terms of helping them with their symptoms. No. So this is a really important point. I'm glad you raised this, is that it's not important. Like a lot of times, you know, docs will make those connections, right? And then they'll be patting themselves on the back and going, yeah, I was really smart and I figured this out. That's not good enough, because you're right, people can't quit their jobs. They need to work, right? And so the bottom line is that patients have to learn strategies that help them to cope with and to deal with stressful interactions, relationships, jobs, circumstances. And so things like cognitive behavioral therapy, hypnosis, relaxation training, mindfulness therapy are all aimed at doing just that. And those can really only be administered with the help of a trained mental health professional. And by the way, I want to say this, is that, and it's not a psychiatrist. Okay, so that's another mistake that people make, is they'll say, okay, well, I'll send them to a psychiatrist. No. A psychiatrist, much like a medical doctor, is trained at giving medicines. Okay, behavioral therapy is most effectively and most consistently administered by psychologists. And for GI conditions, the best outcomes are going to be achieved by people who are specifically trained in GI behavioral therapies. We're very fortunate at University of Michigan to have a fully trained GI psychologist that works with our group, and we've had absolutely life-changing outcomes for some patients. And it's not just as adjunctive therapy. These therapists can be primary therapy, so without medication, or they can certainly enhance the benefits of traditional medical therapies. Now, it's obvious that not every practice is going to be large enough. We have 70 gastroenterologists at the University of Michigan, so we have more than enough business for a psychologist. Most practices aren't going to have enough business to be able to support a psychologist, and in that circumstance, really, it's all about identifying a mental health colleague in your community that has an interest in GI disorders and perhaps is willing to go take a course or read about or go to DDW or the ACG meeting and learn about specifically gut-targeted GI behavioral therapies. It's highly variable. So psychological therapies, behavioral therapies, for some patients that have mild situational anxiety, mild symptoms related to situational anxiety can be the only therapy they need. On the other hand, patients that are more severely affected almost never get better completely only with behavioral therapy. In other words, a lot of the patients with GI disorders have almost a PTSD kind of illness. And so behavioral therapy is part of the treatment equation that oftentimes will encompass diet, medications, as well as behavioral techniques.